ನಮಸ್ತೆ ಗುರುಗಳೇ. ನಾವು ಮಾಡ್ತಾ ಇರೋದು ರೆಸ್ಪಿರೇಟರಿ ಸಿಸ್ಟಮ್ನ ಸಿಂಪ್ಟಮ್ಯಾಟಾಲಜಿ. ಸೊ ಇನ್ ದ ಸಿಂಪ್ಟಮ್ಯಾಟಾಲಜಿ, ಫಸ್ಟ್ if the person is coming from some cough or something else like that, okay, if the person is coming from cough, what is the definition of cough? This is an forced expulsive maneuver against initially closed glottis, causing correct sound. So it's a forced expulsive maneuver against the initially closed glottis, causing correct sound. So the cough is divided into two types. What is that? On two types: acute and chronic. So acute and chronic. And this acute and chronic, acute is less than 3 weeks, and chronic is greater than 8 weeks. So on the basis of the cough is divided into many types. So how it is? First, it is divided into dry, okay, and next productive, barking, bovine, and brassy. So these are the types of coughs. Okay, in the dry, we'll be dealing with ACE inhibitors, produce the dry coughs. Interstitial lung disease produce the dry cough. Alveolar cell carcinoma, this will produce the dry cough. So what is the productive cough here? The productive cough with the expectorant. ಕಫ ಬರುತ್ತಲ್ರಿ ಅದು. ಬ್ಯಾಕ್ಟೀರಿಯಲ್ ಇನ್ಫೆಕ್ಷನ್, ಇಫ್ ದೇರ್ ಇಸ್ ಎನಿ ಬ್ಯಾಕ್ಟೀರಿಯಲ್ ಇನ್ಫೆಕ್ಷನ್, it will call suppurative lung disease, okay, and any pneumonia and any lung abscess, bronchiectasis, empyema, okay, and pulmonary TB. Coming to the barking, laryngeal infection, okay, and if you say the tumor, there will be something like stridor with inspiratory sound, okay, that is stridor. Next we got to take with the bovine. This is due to the compression of recurrent laryngeal nerve, okay, that is expulsive. And coming to the brassy, this is due to the metallic sound. And another due to the tracheal compression. This is due to tracheal compression. So D, P, P, B, P. That's it. Okay. And these tracheitis as well as pneumonia, early pneumonia, and early pneumonia. So what it does, it will be initially that it will be dry in the early pneumonia, centrally painful, with a non-productive cough. So extra pulmonary cause of the cough. take this as occult, GERD, sinusitis, post nasal drips. This is a daytime cough. Okay. So if you see the origin of the cough, if you see the cough based on origin, so by the basis of origin, we will be getting that as pharynx, larynx, trachea, bronch, laryngeal parenchyma, drug, aspiration, nocturnal cough, left heart failure. Okay, these are things. So primarily we'll be taking the cause. What are the causes here? For the pharynx, here post nasal drip, laryngitis, whooping cough, tracheitis. For the bronchi, COPD. That is at 6 a.m. COPD. 6 a.m. Yeah. And asthma. That is 6 p.m. Because in the morning there will be a more anti-inflammatory cells. But by evening there will be no anti-inflammatory cells here. The inflammation dominance goes on. So there will be evening asthma, that is 6 p.m. Lung parenchyma, as we know, TB, pneumonia, bronchiectasis, pulmonary edema. If you take a drug, before that we saw that ACE inhibitors are the causing for dry coughs there. And aspiration, GERD, gastroesophageal reflux disorder. And the nocturnal cough, bronchial asthma. And here, left heart failure, that is dry cough. Tropical eosinophilia. You can take that. This is the end of types of cough and where it originates.